everyone. Today we're going to talk about whether or not your child might need braces and what kind of signs that you should look for to determine when it is appropriate for them to get braces.
Do I look funny? Of course not. You look beautiful. Thanks, Cindy. But how do you get the toothpaste through all that barbed wire?
This is Dr. Tamisha Denis, and this is the Modern. So I have parents every day bring to me young children and ask me the question, does my kid need braces? The reason that that is often frequently asked is because when a child is growing up and they are losing their baby teeth and getting in their adult teeth, sometimes things can look a little out of whack. And parents become concerned that these are signs that their child might need braces. Now, when I use the term child, what I'm really saying is kids who are in a transitional period. And we call that in dentistry transitional dentition. And all that means is that when they start to lose their baby teeth, usually around the age of 5 or 6, and start to replace them with adult teeth, they have also what we call a mixed dentition, meaning they have some baby teeth and some adult teeth. Now, some kids, when that comes in, they have big gaps in spaces, and some kids, it looks all crowded. And what the parent becomes concerned about is, what is this really going to look like in the end? So I'm just going to go through two main scenarios, which are warning signs or maybe early intervention signs. Maybe you should consider getting a consult with an orthodontist to determine if it's appropriate for your child to get braces. So let's go back a little bit. So now around 5 or 6 years old, the kids start to lose their teeth and replace them with adult teeth. Usually that period is over around 12. Some kids it's a little later, like 13, but that's okay too. I always say as long as the teeth are present, meaning if you take an x-ray, you can see there's a tooth that's going to push that baby tooth out, we're okay. Just some kids take a little longer than others. Some kids do it a little earlier. When I'm talking about a kid, I'm talking about anywhere between the ages of 5 and 6 to about 12 and 13. Now, one of my favorite sayings I like to say in the office is, when you're a hammer, everything's a nail. And I say that really in reference to specialists, my dental specialists out there. Maybe they may not like to hear this, but I'm a general dentist, and if I send someone to a root canal specialist, most of the time they're going to tell you need a root canal. If I send you to an orthodontist who is a braces specialist, most of the time they're going to tell you need braces no matter what the situation. So I'm going to tell you some two key things that as soon as I see those things, I absolutely think it's time for early intervention. Now, the first thing that I'm going to talk about is what we call in dentistry a crossbite. Now, a crossbite means, and I'll show a picture of it right here, but a crossbite means basically the normal way that our teeth come together is that the top teeth are outside of the bottom teeth. So if you can see the arch of the teeth, the bottom teeth are tucked in the top teeth. Now, some people, they have a crossbite, and that means that their bottom teeth are outside of their top teeth. So if you can imagine a scenario where this is the top teeth over the bottom teeth, it's like this. And the problem with that is sometimes that indicates that the top jaw is not wide enough and the bottom jaw is sitting outside of that. Now remember, we're dealing with growing kids. So usually that is something that I say, we may consider seeing an orthodontist to get in there early. Sometimes they'll do palatal expanders, which means they're gonna put something on the roof of the mouth to extend those top teeth out and get those bottom teeth within the frame of the upper arch. The reason that that's an important early intervention is when we get older, as our symphysis, or the line in the middle of our palate or a roof of our mouth fuse, it becomes more difficult to fix that. So yes, I say, you know what, you can live with crooked teeth your whole life. You could live with all kinds of things your whole life and never get it fixed. You can, and it's not a problem. However, there are some bite problems. We call them malocclusion. There's some bite issues that are better fixed while we're young and we're growing, because when we get older, it becomes much more difficult to fix something like that. Now, the second issue that I usually try to encourage parents to do an early intervention is something called a class 3 or an underbite. And an underbite means your bottom jaw sits more forward than your top jaw. Now, remember, that's in contrast to an overbite. And an overbite means your upper jaw, your upper jaw a little bit more forward than your bottom jaw. Now, of course, all of those things can be fixed with braces, but I'm talking about kids. I'm talking about early intervention. That's also something that's very difficult to fix if you wait too late, because as that jaw starts to grow, it becomes harder as an adult after everything is kind of set in stone for you to correct an underbite. Overbite still maybe need to be corrected when you are younger. However, these are two key things, the crossbite and the underbite, that me as a general dentist are kind of flashing, glaring. We need to really see an orthodontist to consider whether or not they're braces. Now, that's not usually the scenario I see. Most parents, like I said before, are complaining maybe the gaps are really big or things are really crowded. And they also may indicate that there may be some early intervention with braces that are necessary. But for me, those two things, I say for sure, let's get them fixed while they're young. Now, if you're really concerned and none of those two scenarios, you can always see an orthodontist for a consult. The issue is something called phase 1 and phase 2, which what a lot of orthodontists do. That means that they'll put a kid in braces when they're still in mixed dentition, and later on they'll fix something and say, we're not quite done and we still have to do phase 2. And I've seen kids in braces for 7 years, which is a really long time. So my opinion is, unless it's a skeletal issue, meaning that there are things that as an adult that you cannot fix. And in dentistry, an adult means you just have all adult teeth. That doesn't mean you're 18, 19, 20. That just means maybe you're 13 or 14, which I think ideally is the best time to get braces, because when you're 13, 14 and that sort of thing, you're much more responsible and you can start to take your oral hygiene very seriously. And what it also does, it creates a scenario so that they can do some self-care themselves. When you're 7 or 8 years old, it becomes a lot more difficult to encourage a kid to do the things that they're supposed to do to keep their teeth really healthy. And I've also done other videos about how to keep your braces or how to keep your teeth clean while wearing braces. And the younger you are, the more difficult it is to do those things. So those are my top 2 reasons that I would kind of push a parent to consider an orthodontic consult. Like I said before, there's a lot of other different scenarios that require early intervention, but those are my top 2. I hope you enjoyed this video and the content that I provided. If you liked it, make sure to give me a thumbs up and subscribe to the channel. Thank you for watching.